Getting a kid to brush their teeth is a nightly battle. Those 2 minutes at the sink are the first defense against adult heart disease. In this video, we are looking at a massive new study linking childhood dental records to adult heart disease. We will trace the exact biological pathways that connect the mouth to the heart, and finally, look at a specific brushing technique used to disrupt the process. Researchers at the University of Copenhagen analyzed the health records of over 568,000 people to track this connection. They pulled childhood dental records from the 1970s and tracked those exact individuals for decades, matching their early tooth decay to adult diagnoses like ischemic stroke and heart attacks, all the way through 2018. This chart shows the risk increase they found. Compared to a healthy baseline, males who had severe childhood cavities faced a 32% higher risk of cardiovascular disease as adults. For females, the risk increased by 45%. How does a localized cavity in a 7-year-old physically transform into a life-threatening heart attack at age 50? This graph tracks oral disease trajectory over a lifespan. The highest cardiovascular risk was in individuals who followed this persistently poor trajectory, where dental health remained bad throughout childhood. Repeated exposure to cavities and gum disease triggers chronic, low-grade inflammation throughout the body. Remaining in this prolonged inflammatory state throughout childhood miscalibrates how the immune system responds to stimuli later in life. This misfire sets the stage for atherosclerosis. This is the physical hardening and narrowing of adult arteries caused by the buildup of plaques, slowly restricting blood flow over time. Tooth decay acts as the ignition switch for a lifelong systemic immune misfire. The second biological mechanism is bacteremia. Bacteria living in the mouth escape through inflamed gum tissue and drop directly into the systemic bloodstream. These traveling microbes do not disappear. Scientists found 23 distinct species of oral bacteria living directly inside atherosclerotic plaques in human hearts. Furthermore, changes in the metabolic activity of the oral microbiome, the entire community of bacteria in the mouth, are directly associated with high blood pressure. There's also a genetic component. Some people possess shared genetic pathways that predispose them to both dental disease and cardiovascular issues. However, this biological reality makes proactive oral care a more urgent necessity, not a lost cause. The mouth acts as an open biological gateway, making oral bacteria a direct threat to the cardiovascular system. Treating a child's cavities protects the cardiovascular system long after those baby teeth have fallen out. It serves as a foundational intervention for population-wide heart health. To prevent this entire chain reaction, dental experts recommend teaching children the modified Bass technique. Hold the brush lightly, placing the bristles at a 45-degree angle to the gum line. Use gentle, vibratory, back-and-forth motions in that spot to disrupt the plaque. Finally, sweep the brush away from the gums toward the biting surface to clear the bacteria. To recap, chronic inflammation and wandering bacteria create a biological pathway from the mouth to the heart. Executing the modified Bass technique effectively disrupts the plaque that causes this systemic damage. The nightly brushing battle is a daily 2-minute investment in a child's lifelong cardiovascular health.